Today I'm going to take you through the changes that happen in your feet and your lower legs during pregnancy and breastfeeding. So during the process of surging hormones, our body responds to this by releasing relaxin hormones that actually help to prepare us for birth. Things like oxytocin, which actually helps with milk production, and progesterone can actually encourage the ligaments around our joints to loosen as they prepare for the pelvis to change shape and let the baby through. But this also affects the joints in other areas of our body. So if you can imagine our feet, they will change shape. So you may find your feet become longer and wider as your foot relaxes and flattens out, increasing even in half or one shoe size. And this is very common in pregnant women, and it doesn't always rectify after childbirth. So as our feet relax, the muscles around there, or the muscles around all the joints, including the knees and the hips, have to spasm and tighten to work harder to stabilize your joints, because your ligaments aren't working as well, or they're loosened, so your muscles work harder. As they work harder, you can get things like muscle cramps, muscle tightness, restless legs, sciatica in the hips. Often your hips can become so painful it's really uncomfortable to sleep on your side, and you often get woke up in the night due to the restless leg symptoms. All very common during pregnancy and breastfeeding. And what we also find, particularly during breastfeeding, is that when you're getting up in the night to feed your baby or jumping out of bed, there tends to be a lot more inflammation in the heels and the calf, and it can become very painful those first few steps. So what we want to do is kind of educate you on all the problems that we see in our feet and our lower legs, and how you can effectively prevent a lot of these problems. Now, another one that I haven't spoke about is dry skin. So again, during pregnancy, our blood flow increases, the skin cycle increases, so we tend to develop more skin cells, but they don't slough off as well in some people. So what you end up with is dry, cracked skin, and we need to use more emollients and anything to hydrate the skin, and drink a whole lot more water, as well as taking vitamins. So now we've looked